Knee joint is made up of three main bones: the femur, or thigh bone, the tibia, or shin bone, the patella, or kneecap. They slide in a groove surrounded by cartilage. In total knee replacement surgery, a badly functioning or very painful knee is repaired with artificial parts. Your whole knee isn't actually replaced. The damaged parts get new surfaces that will work better, which will help you move without pain. To start, your doctor makes a cut along the front edge of your knee. He'll separate the surrounding muscles and ligaments to get into the joint. Next, he'll remove all the damaged bone and cartilage at the end of the bones, as well as the underside of your kneecap. Next, he'll prep your bone to receive your new artificial knee. Like your knee, it has three parts called the femoral, tibial, and patellar components. Next, the surgeon will cement the new pieces into place. But before he closes your knee, he'll take an X-ray to make sure that everything is where it's supposed to be. Finally, he'll close your knee with stitches or staples and put in a temporary drain so that any fluid that may develop can flow out.